Brain arteriovenous malformation. What happens when arteries and veins connect correctly without capillaries in between? The result can be dangerous condition called a brain arteriovenous malformation. Hi, my name is Dr. Vas, and today we're going to discuss brain arteriovenous malformation. The key concept: it's a high flow vascular shunt that can disconnect, irritate, or destroy neuronal network through hemorrhage. What is brain AVM? An abnormal tangled network of blood vessels in which arteries connect directly with the veins. High pressure arterial blood enters the thin walled veins, placing them under abnormal stress and raising the risk of intracranial bleeding. Vascular shunt pathway, feeding artery, AVM nidus, and draining vein. This is the vascular shunt pathway. That is very important. Normal flow versus AVM flow. That is the normal cerebral circulation, artery, capillary bed, vein. But in AVM circulation, feeding artery, nidus shunt, and draining vein, there is no capillary bed in between, and that is the major root cause of the in AVM. That is the immediate consequences: vascular seal from nearby tissue, vessel dilation, and aneurysm, risk of rupture. Mechanism: abnormal vessel tangle leads to artery vein shunt, high pressure venous flow, vascular seal and hypoxia, irritation or hemorrhage, neuronal deficit. That is the direct shunt causes. Reduce blood delivery, vessel dilation, compression, irritation, or injury. Basic mechanism: high flow stress, vascular seal, vessel dilation and rupture, and neuronal injury. That is the neuronal linkage, hemorrhage that leads to AVM nidus, reduced perfusion, seizure network that also leads to AVM nidus and venous congestion, and that leads to finally the network deficits in the brain. Clinical presentation: sudden severe headache, seizure, weakness or numbness on one side, speech or visual disturbance, problem with balance, confusion or loss of consciousness. Diagnosis: uh, mostly imaging. Uh, the physician going to do the imaging, non-contrast CT, CT angiography, MRI, and digital subtraction angiography. The diagnostic goal is confirm AVM presence, detect hemorrhage, map feeding arteries, guiding treatment choice, and procedural risk estimation. Treatment: observation plus symptom control, stereotactic radiosurgery, microsurgical resection, endovascular embolization, combined approach. Prognosis, a good prognosis is when AVM is small, non-eloquent location, complete obliteration, follow-up imaging. High risk when deep, large AVM is located, complex venous drainage, previous hemorrhage, and residual AVM. That is the important for the follow-up concept. And that is the schematic summary or schematic summary of the brain AVM, and that is the graphical summary of brain arteriovenous malformation, and that is called the brain AVM. Thanks and regards. Please like and subscribe this channel for further discussion on rare diseases. Thanks.